Okay, so I'm going to be very proud to present you our idea of intervention room, okay, procedure room we call it, okay. So basically, every time we need to do a procedure which is not typically done in an examination room, we bring the patient here, and we're going to be ready that we do this intervention for all kind of primary care situation we may have here, but we are ready to stabilize the patient. Let's say somebody is getting into a difficult situation. So for this, we are equipped with a standard highest quality resuscitation monitor and defibrillator. It's all the vital signs which can be monitored here, and you can stabilize the patient until the ambulance will come. Then, for intervention, medical intervention, we have all the necessary medication to stabilize the patient, like including from epinephrine, all the medication you need in a crash cart, plus standard medication for heparin. Okay, let's say somebody's coming with a heart attack and we didn't know. We don't want to have them here, but we don't want to crush them in a Walmart. Okay, and other kind of medication. Also, we have IVs, and we can we have a program for IV therapy. Instead of people waiting in the waiting room for a cellitis to get IV antibiotics, they can come here, and we have also always a nurse on site who can do this, and we have all the supplies necessary. For stabilization of the airways, we have here the intubation equipment, we have the nebulizer for administrating Ventolin and Atrovent if it's necessary, and for bagging the patient we have oxygen, and as you can see here, sorry, we have the bag mask, the oxygen, and the vacuum. If somebody's choking, or we have to vacuum like foreign objects. Then we continue with wounds. We have all the materials necessary for treating any kind of wound in acute or in follow-up phase, with medication, with dressing. We have here for suture materials, all kinds of cuts. We have all kind of treatment for cutted wounds, and also we have for biopsy, for skin biopsies. We have liquid nitrogens, and as you see the tank there. Also we have Doppler for Doppler ultrasound for the female in pregnancy, but also for acute situation when the blood vessels can be blocked. Here we have all the IV materials, syringes, injections, and suture material, okay? Different kind of kits for sutures. If you continue on the other side, I'd like to introduce you to the like we have always, so we have the C stabilizing equipment, cervical spine, but also we have equipment, and I like to show you for podiatric patients, okay, small lumps and bumps. We have also materials here for treating different kind of wounds, including a situation when you need a fluid enema to be done. We never did it, but we are ready for somebody's coming with a blockage. Also, we have here all the materials for splints, for casting, splinting, stabilizing fractures, and which in conjunction with future X-ray room is going to be a very good benefit, since we can free up the emergency room, so the patient don't need to come to emergency room to have all these things done. Here we have the equipment for surgeries for different kind of departments. Okay, in general surgery we can do also sigmoidoscopy and rectoscopy, but also materials we can trace like this, ready for intervention, which are sterilized on site, okay, by our nurses and our staff, okay, and we are fully equipped for not just the basic, but an enlarged range of procedures. Here we have the equipment necessary to treat kind of eye, ear, and nose issues, okay, and we're still going to have a split lamp. And here we have, in case something is happening, we have an intervention bag, which is where you have all the materials like ready to go. Let's say something is happening in the mall. Sometimes you take part in a sport event, so, but we are fully equipped, and all the materials are organized for intervention. What I like also to hear is a new thing we added recently. We have the materials to be ready for any kind of infectious disease disaster, for Ebola. So in case something is happening, like hemorrhagic disease, viral disease patient is coming, we are ready to protect our staff and the rest of the patient. We are very nicely equipped with an electric table, which can be prepared and set up the patient in different kind of positions, ready for for different kind of intervention, and has a very high mobility, which make it accessible for small or big patients at the same time. The other thing what I like to present for different, because we like to extend the level of intervention we do, we have electrocautery equipment, and very soon we're going to have small endoscopy equipment for small orifices. So this is our intervention room, including with this lamp, which we're going to probably hire up very soon, okay? Is making a space where basically with good doctors and good nurses we have here, we're able to handle any kind of situation we can encounter.